Most of them moved for work, or because the living conditions or the situations there were poor. It doesn't mean that things were wonderful here either, although most of them have had, most of the Aboriginal patients that I see have all the same health problems as everybody else, but there is an increase, particularly in diabetes, that I see that it's a higher frequency, and coronary artery disease is probably at a higher level too. The other thing that I see is sometimes the sequelae of infectious diseases that maybe isn't as common in the general Canadian population. Specifically, many of my patients have had TB. In the sort of the 40 to 60 age group, some of whom who have experienced residential schools, there is, I'm just thinking of a couple of my patients who I would say still do have some post-traumatic stress related to their experiences as children. A lot of them, I think there's probably more who have had that experience, and that might be one of the reasons for leaving the environment and moving to an urban area. But not all will, they will allude to it, but they don't really want to focus on it. A lot of people return to the reserve, for example, when they're older, and because that's where the family is. Many have conflicts because their children are even less aware or involved in their heritage.